Hi friends, welcome back to my channel Only Bio, presenting up the fifth part of the revision of the chapter Excretion and Osmoregulation all in details. Friends, I hope you're following the series. Please do check the playlist so that you also get to know about the other chapters. So, in this, I've included all the easier points as well as much more additional information has been given. So please do watch till the end. And if you have any suggestions or comments to make, so definitely I'm waiting for them. In this session, we are ought to talk about the human excretory system. Now, in humans, the excretory system consists of a pair of kidneys, one pair of ureters, a urinary bladder, and a urethra. Now, these kidneys are reddish brown, bean shaped structures situated between the levels of the last thoracic and third lumbar vertebra, close to the dorsal inner wall of the abdominal cavity. Friends, this is a very important point. Okay, now remember, in humans, the kidneys are located high in the abdominal cavity, like one on each side of the spine, and they lie in the retroperitoneal position at slight oblique angle. Now, the asymmetry within the abdominal cavity is caused by the position of the liver, typically that results in the right kidney being slightly lower and smaller than the left and being placed slightly more to the middle than the left kidney. Now, the left kidney is approximately at the vertebrate level of T12 to L3 and the right kidney is slightly lower. So the right kidney sits just below the diaphragm and posterior to the liver, whereas the left kidney it is found below the diaphragm and posterior to the spleen. And on the top of each kidney there is a gland that is either called as adrenal gland or suprarenal gland. And the upper parts of the kidneys are partially protected by the 11th and the 12th ribs. Each kidney with its adrenal gland is surrounded by two layers of fat, that is the perirenal fat present between the renal fascia and the renal capsule, and the pararenal fat that is superior to the renal fascia. Coming to the next point, each kidney of an adult human measures 10 to 12 centimeters in length, 5 to 7 centimeters in width, 2 to 3 centimeters in thickness with an average weight of 120 to 170 grams. Towards the center of the inner concave surface of the kidney called as a hilum, through which the ureter, blood vessels and the nerves enter. A pair of ureters arise from the pelvis of each kidney. Friends, pelvis area kya hota hai? You will understand more about pelvis in details when we do talk about the LS of the kidney or the histology of the kidney in the next part. Right now, you will have to look on the screen and just understand that it is a more or less funnel shaped structure of the kidney which continues into the ureter. Each ureter is a long muscular tube, say around 25 to 30 centimeters in length. Ureters open into urinary bladder by separate openings which are not guarded by valves. They pass obliquely through the wall of the urinary bladder. This helps in the prevention of the backflow of the urine due to compression of the ureters while the bladder is filled. The urine is conveyed to the urinary bladder by peristalsis, very important. The ureter is lined by transitional epithelium. This epithelium allows the stretching without getting torn off. So friends, this is the reason why here we find the transitional epithelium. This can be asked to you in the MCQ or a one-liner question. Now let's understand about the urinary bladder. It is a median pear-shaped sac. It is a hollow, muscular, distensible. Distensible means flexible. Organ situated in the pelvic cavity just above and behind the pubic bone, posterior to the pubic symphysis. I hope you know this pubic symphysis. It's a point where the two pubic bones join on the ventral side that comes more or less between the legs. At the base of the wall of the urinary bladder, there is a small inverted triangular area called as the trigone. Just because it is triangular, it is called as the trigone. At the apex of this triangle is the opening of the urethra. At the two points of the base of the triangle are openings of the ureters. The bladder receives urine through two ureters, one from each kidney, that enters through openings called as a ureteric orifices. Urinary bladder is covered externally by the peritoneum. Inner to the peritoneum is a muscular layer, and it is formed by detrusor muscles, which consists of three layers of smooth muscles. First is the longitudinal layer, then the middle one is the circular, and the inner one is longitudinal layer, respectively. Innermost layer is made up of transitional epithelium. The cells of this stratified tissue change the shape based on whether the bladder is empty or full, allowing it to remain elastic, accommodating up to half a liter of urine. Matlab, it never gets torn off even though if it is stretched. That is the reason why there is a specialized epithelium called as transitional epithelium there. A very, very important point, friends. The transitional epithelium helps the bladder to stretch. When empty, the bladder is about the size and shape of a pear. The bladder stores urine, allowing urination to be infrequent and controlled. The bladder is lined by layers of muscle tissue that stretch to hold the urine. The normal capacity of the bladder is 400 to 600 ml. During urination, the bladder muscles squeeze and two sphincters, that is valves, open to allow the urine to flow out. Urine exits the bladder into the urethra, which carries the urine out of the body. Now let's have some additional information about the urinary bladder. Friends, cystitis. It's the inflammation or the infection of the bladder causing acute or chronic pain or discomfort or urinary frequency or hesitancy. Bladder cancer. A tumor in the bladder is usually discovered after blood is found in the urine. Cigarette smoking and workplace chemical exposures cause most cases of bladder cancer. Overactive bladder. The bladder muscle, that is the detrusor, squeezes uncontrollably, causing some urine to leak out. The detrusor overactivity is a common cause of urinary incontinence. Friends, urinary incontinence is a problem seen in many of the aged people, wherein the urine starts leaking out, even though if at all they are not micturating, or rather they are not really passing out urine, it simply drops down. That is what is meant by urinary incontinence. The urinary bladder is emptied by the process of micturition, that is the act of urination. In men, the bladder lies on the pelvic floor in front of the rectum. In women, it is located near the uterus, leading to a number of changes to the patterns of micturition during the course of pregnancy. During the course of gestation, gestation is nothing but pregnancy. There are major changes to the blood volume and increases in the glomerular filtration rate. That is the rate at which the primary urine is formed after filtration in the nephron. So while the bladder itself increases in size, nearly doubling by the end of the third trimester. A third trimester is nothing but the seventh, eighth, and the ninth month of the pregnancy. The enlarged uterus with the weight of the fetus, amniotic fluid, placenta, and other tissues can create stress incontinence. Embryologically, the bladder is derived from the urogenital sinus, and it is initially continuous with the allantois. I hope you know allantois is one of the extraembryonic covering membranes. Friends, this information is all additional. I hope you will agree with me that it's all important and additional information not there in your books. In human males, the base of the bladder lies between the rectum and the pubic symphysis. It is superior to the prostate and separated from the rectum by the rectovesical excavation. In females, the bladder sits inferior to the uterus and anterior to the vagina. It is separated from the uterus by the vesico-uterine excavation. Now let's understand something about urethra. It is a tubular structure arising from the urinary bladder and opening to the exterior of the body. There are two urethral sphincters between urinary bladder and urethra. First is the internal sphincter, made up of smooth muscles, involuntary in nature, lining the bladder neck and urethra. It receives its nerve supply by the sympathetic division of the autonomic nervous system, whereas the external sphincter is made up of striated muscles, voluntary in nature, and if this valve is not functioning properly during inflammation of the bladder, it can lead to kidney infection. So friends, we have to remember that urethra is a passage for discharging the urine from the body. And in males, it acts as a urinogenital organ. We may call it as a urinogenital duct. This can be asked to you as a Q reason. Now, what is the reason behind it? It's very simple that in males, the urethra passes through the penis and it acts as a common passage for both urine as well as semen. Now friends, but obvious आपके दिमाग में क्वेश्चन आ चुका होगा कि when it acts as a common passage, can urine and semen pass out together? So no, it would never happen because there are sphincters that have a control over it. We also have to understand the differences between the male urethra and a female urethra. So friends, these are the differences between the male urethra and the female urethra. I've given it in details so that if asked a question, so you're in a position to answer it. So let's discuss it. Male urethra is the canal through which both urine and semen are passed in males, whereas female urethra is the canal through which urine is passed in females. The second point is male urethra is longer, almost 20 centimeters as it passes through the penis, whereas the female urethra is shorter, around 4 centimeters. Third point, the diameter of the male urethra is around 8 to 9 millimeters, whereas the diameter of the female urethra is around 6 millimeters. Fourth point, the male urethra opens to the outside at the tip of the penis, whereas the female urethra opens to the outside anteriorly to the vaginal opening. Fifth point, it belongs to both excretory and reproductive system, whereas the female urethra belongs only to the excretory system. Point number 6, male urethra also serves as a passage for the ejaculation of semen and hence it's called as a urinogenital duct, whereas the female urethra serves as a passage for only urine. Point number 7, male urethra, the bacterial infections are less common, whereas female urethra is more prone to be infected by bacteria. Now, definitely you will have a doubt ki why so. The reason is because if you look at the position of the female urethra, so we find that the female urethra has two more openings besides it. One is the anal aperture and the other one is the vaginal aperture, right? So anal aperture, the way through which the waste products, the undigested waste products are thrown out. So it is possible while cleaning up that area, it is possible if at all it's not properly cleaned because of unhygienic conditions, it is possible that the bacteria might interrupt this urethra and even can cause the what you can say, the urinary tract infections can be seen more commonly in the females. Point number 8, male urethra is more affected by the passing of the kidney stones, whereas the female urethra is less affected by the passing of the kidney stones, but obvious because it's shorter. Male urethra, point number 9, it has three regions. The prostatic urethra, that is that part which passes through the prostate gland. Then the membranous urethra, that's a small part between the prostate gland and the penile region. And the last part of the urethra is the penile urethra. whereas the female urethra is not differentiated into any regions. Point number 10, the sphincter controls the movement of urine and semen in case of male urethra. In case of female urethra, the sphincter controls the movement of the urine. Friends, I hope you have understood these points of differences clearly. Now let's understand what is micturition. The average capacity of the urinary bladder is 700 ml. When urinary bladder is almost half filled, the stretch receptors in the urinary bladder transmit the impulses to the spinal cord. This initiates a conscious desire to expel urine. Micturition reflex center of the spinal cord transmits the impulses to the wall of the urinary bladder and the internal urethral sphincter. So the bladder muscles contract and the muscles of the internal urethral sphincter relax. Then external sphincter receives impulses from the conscious center of the brain and relaxes. This leads to expellation or elimination of the urine from the bladder. Infants up to 2 years of age show lack of voluntary control over micturition. This is because the neurons to the external sphincter muscles are not developed. Let's understand the functions of the kidney. First, separation and elimination of nitrogenous wastes. Friends, if you wish, you can even write the nitrogenous waste like, into the brackets, you can enlist them. Or you may even write the metabolic wastes. Second, elimination of excess water and toxic substances from the body. Third, osmoregulation, regulation of pH of the body fluids. That is, in simple words, it brings about homeostasis. Fourth, secretion of calcitriol and renin. I hope you know this. Fifth, secretes erythropoietin for the synthesis of RBCs. Friends, I hope you've liked it. Please subscribe and hit the bell icon if you haven't yet done this. Thank you so much for being with me.